Welcome, everyone. I would like to introduce Dr. Erin King-Mullins, who is a double board-certified general and colorectal surgeon, Atlanta Magazine Top Doctor 2024 and 2025, and founder of Tushy Touch Up, a restorative outpatient procedure that helps patients regain comfort, hygiene, and confidence after hemorrhoids, childbirth, or other anal and perineal changes. She leads the Colorectal Wellness Center in Atlanta, where her practices focuses on compassionate, minimally invasive solution for common but often unspoken colorectal issues, including hemorrhoids, fissures, fecal incontinence, and colorectal cancer screening. Dr. King-Mullin also serves on the American Board of Surgery Council and is the president-elect of the Society of Black Colorectal Surgeons, where she champions patient education, innovation, and diversity in surgical leadership. Her work bridges clinical precision with empathy, empowering patients to talk about sensitive concerns, understand their options, and pursue comprehensive care that restores both function and confidence. I'll hand it over to Dr. Erin King-Mullins now.
Thank you so much, Como, for that wildly inspiring introduction. I didn't even know most of that stuff about myself. I'm just kidding. In jest, I want everybody to loosen up tonight. I can't see you, you can see me, and I'm just very excited and humbled and honored that you all will take time out of your busy schedule to listen to me this evening, especially for yourselves to, help take care of an issue that you may have been suffering in silence for so long. So on this screen, you might see some questions and statements. Many of you may already have these questions in your head. You feel concerned, exhausted, overwhelmed, but you're too embarrassed to talk about it. As many as 54% of patients who have bowel control problems have never even discussed this with their physician. That's quite a number of people who have not been able to have the comfort or confidence or feel they have the ability to discuss something with their doctor that is very distressing to them and that can impact their quality of life significantly. So too often people are just not getting the help they need. So we're here to change the narrative around that. And so we're going to provide some information about some therapies that, especially a particular therapy that's helped quite a few people. So the important thing to know is that bowel issues are not inevitable. Okay, ladies, and I'm speaking to the men as well, but particularly women are often told that this is their lot in life after having children, and so it's not inevitable. It's really important to know that incontinence is not a normal part of aging. It can affect patients of all different backgrounds, ages, men and women. So bottom line is you can call it whatever you want. You may call it incontinence, bowel incontinence, fecal incontinence, FI. It's a very embarrassing condition. And while we see so many targeted therapies and ads and things focused on bladder incontinence, we need to discuss fecal incontinence as well. And so we do have to make sure that we clarify exactly what we're talking about when we talk about it, because it's a very embarrassing condition that can have a significant impact on quality of life. It may prevent you from going places, going to celebrations, traveling. You're always looking for the next restroom, or where every restroom in the city is, at least the clean ones. So if that's the case, I really want you to focus in and listen today. You need to know you're not alone. Okay. Again, it affects people of all ages. And if you actually look at the stats and the numbers, if you see here on the screen, bowel control problems affect about 1 in 12 US adults. Again, so that's all comers, all ages, all sexes, all races, all different types of histories, medical conditions, having children or not, having surgery or not, okay? And when we look at those stats and we look at those numbers, we realize that it actually is more prevalent than Alzheimer's disease. It's more prevalent and more common than asthma. So these two conditions we obviously think of as being very common, right? It's a day-to-day household name. You see the commercials all the time on television, or the ads on the radio, or whatever your streaming is. Those are very common conditions. and bowel incontinence is actually more prevalent than those. So you might be asking yourself, if it's so common, why aren't more people talking about it? And, a lot of people who initially start experiencing symptoms with fecal incontinence, they try to treat it on their own. They may change their diet, they may start wearing pads or restricting social activities or only traveling so far or only traveling in a certain manner. And so they're kind of self-treating at home. And so they may not talk about it, but it can lead to some pretty serious psychosocial conditions, embarrassment, depression, decreasing quality of life. And so while many people with chronic fecal incontinence may decide to self treat, um, oftentimes physicians just don't even realize that they should ask about it because a lot of physicians themselves don't realize that the prevalence is even higher than asthma and Alzheimer's disease. So basically, at the end of the day, if I'm not asking you, you're probably not going to tell me. So we're going to get into right now a little bit of how does bowel control work? It's a very complex issue that takes into account a patient's physiology, anatomy, prior histories, but then just some baseline neurological function. So we have to understand what your body is saying, and it's critical to know how the bowel works. And so there's this communication pathway called the bowel-brain communication. And so basically, what happens is you eat, and your digestive system is going to push that food down through your intestinal tract. And it takes a level of coordination for your brain and your body to realize, over that 24 to 40, excuse me, that 24 to 72 hours when your intestines are processing and digesting the food forward via their muscular contractions. Once it kind of gets down to the lower end to the rectum, you're going to get to the sphincter muscles down in the rectum. And what happens is when the rectum distends, when it gets filled with waste, those sphincter muscles are supposed to detect and send signals up to the brain. The rectum sends messages up to the brain to then tell those sphincter muscles to relax and open, that it's time to defecate, that it's time to pass the waste. But if those wires are crossed, then you lose some of your functional control. Those signals are not appropriate. They're not aligning the way they should. And so you don't have control on when it's time to empty your waste, or you may not be getting the appropriate signals regarding your waste. So, research has suggested that bowel control problems are linked to that poor bowel brain communication. So, keep those points in mind for later when we start talking about the various treatments. But the good news is, and that's why we're here tonight, there are treatments that can change your life. They can help restore your quality of life. It ranges from conservative treatments to advanced therapies. So we'll talk about these things. Um, there's another number of steps that are involved to kind of figure out if conservative versus advanced therapies are going to be right for you. We just talked about the bowel brain communication. Well, if that pathway is not disrupted, then maybe some of the treatments we talk about this evening aren't right for you. But if it is, tonight's main focus of treatment might be exactly what you need. So we'll talk through some of these different options. So when we talk about conservative therapies, sometimes there are very simple solutions that can help. Sometimes they help, sometimes they don't. Sometimes they kind of need to be supplemented with both the advanced therapies or other conservative therapies. So again, there's lots of steps, and you need to make sure you talk to your physician and your providers for them to evaluate you and kind of help diagnose the underlying cause for your loss of control. And that will let us know whether or not the conservative or more advanced treatments would be best for you, either in single or in combination with each other. So, first thing is, try simple lifestyle changes, right? Think about, the different consistencies that your bowel may have. It can be pretty loose. It could be soft or it can be really firm. And so when you compare those things, think about your hand. It's easier to hold a rock than it is to hold mud, than it is to hold water. So if you're finding yourself having difficulty with a specific consistency of your bowels, then simple dietary modifications and lifestyle changes may help with that. Um, so maybe adding fiber, anti-diarrheal medicines, that may help. Other components for you being able to control your bowel are the muscles themselves, right? The sphincter muscles. Just like any other muscles in your body, if they lose their level of function and integrity, sometimes if you lose function of your arm or your leg or certain muscles, you get referred to physical therapy to help re-strengthen and regain your function in that area. And so the sphincter muscles and the pelvic floor muscles actually have their own dedicated and trained rehab therapists and physical therapists that can help with that, including bowel retraining with biofeedback. And again, certain medications that may change the consistency of your bowels or slow down your bowels to kind of help give you better control. In some instances, these lifestyle changes and dietary modifications may not work for you. And that's when we start discussing the advanced therapies that are available. So one of the main features of tonight, we're going to talk about the Medtronic InterStim system, but there are some other surgical options that play a role in your function in the area, because again, tonight's discussion about the Medtronic InterStim system is really focused and honed in on that kind of bowel and brain control pathway. There's multiple advanced therapies that are out there, and the sacral nerve stimulation called InterStim is how we're going to discuss regaining and restoring that bowel and that bowel and brain pathway. So surgical options. Multiple options that are out there based upon what the actual muscle dysfunction or what needs to be restored in the anal area. So if there's been an anal injury from prior surgeries, that can be repaired. And there's another procedure called the sphincteroplasty. And so if the sphincter muscles themselves have been disrupted, a sphincteroplasty really just reapproximates or bring those muscles back together in alignment so they can function appropriately. There's an artificial anal sphincter that's out on the market that is for dedicated candidates. I have a proprietary procedure called the Tushy Touch Up, and that basically incorporates multiple procedures together that might be necessary to restore both function. And it can include a little bit of cosmesis and aesthetics in the area for patients. And then when all else fails, if there is really no other surgical intervention that can restore your control, there's always the option for the colostomy. Okay. And what a colostomy is, and a lot of people say, oh, the bag, I don't want a bag. And so, what a colostomy is where we actually create an opening in your abdominal wall where we bring your intestine there, and that's where your body evacuates its waste. Again, while no one wants one, and we as physicians don't want to have to give a patient a colostomy, it is based upon your quality of life. And so, as you can imagine, if you have no control of your bowels and you can't leave the house, at least if you're able to pass your waste into a bag discreetly under your clothing, you decide when it's time to go evacuate. And so, again, you're restoring your quality of life and your control. Now on to the main topic for the evening, okay? So Medtronic, who Colorectal Wellness Center has partnered with for this evening's presentation, has created a device, the Sacral Neuromodulation System. The S&M system is another way we describe it. And what it is, if we think back to what we discussed earlier about that bowel brain connection, there's gentle nerve stimulation that helps correct that communication, correct that pathway that has been lost or altered. Um, and so the way this works is it gently stimulates the nerves by helping eliminate some of the background dysfunction. So think about if you're in a noisy restaurant and you might be having a difficult time hearing, your accompaniment. You're like, man, if it can just quiet down in here, or, if there wasn't so many signals out there, I can actually hear you communicate better. That's a good way to think about how the sacral neuromodulation works. It kind of drowns out some of that background signal firing that may be going on that's inappropriate, and really targeting and sending gentle reminders and triggers um, to the nerve system and the muscle to function appropriately. So that's the best way to kind of think about it. So for most patients, it really just takes one really simple evaluation, and over the course of less than a week, to understand if sacral neuromodulation is right for you. Um, Get ready, it's easy. The simple test actually starts at the office or at an outpatient center. And basically, what happens is a very thin wire is inserted in the upper part of your buttock, and it's kind of led down to where the nerves are used, the nerves that stimulate the sphincter muscles. And then it's attached to an external device, and it delivers the therapy. It delivers those little gentle nudges for you to understand and kind of feel. We have to make sure that you feel the sensation in the area to know that we're in the right spot to stimulate the right area. And then we test the therapy. So basically, over the course of a week, there's some adjustments that may be made to the therapy. You're keeping a nice diary of your symptoms and the timing and the changes to kind of help determine if you are getting the improvement that you want. And the programmer actually looks like a smartphone. So it's something that's discreet. And so it's in your pocket. So if somebody comes by and they're like, what's that? You don't have to say, hey, it's controlling my butt. It really does look like another phone or tablet or device. So you can go about most of your day, your activities without any issue. And then at the end of that trial period, after your evaluation, you and I will get together, we'll discuss the results and decide if you want to move forward to the full permanent implant, the full placement. So here's on the screen, you might see this is a depiction of what the app will look like on the device. And so you'll have all personalized information for you to help make informed decisions about your journey moving forward. Does your treatment need to be increased, decreased? There's a diary to easily help track your symptoms and support meaningful conversations, with your healthcare provider, and your family. And then there's different videos and educational content that's available for you to read through. So you can help get all the answers you need to decide if this is the right path for you. And so here's a QR code on the screen to kind of help you get familiarized a little bit with the app that's available. So some of you may have done some research before tonight and may have some questions about whether or not that this device is compatible with MRIs, especially if you are under ongoing treatment or surveillance for certain other medical conditions. And so Medtronic does have MRI compatible systems. Okay, so they have a proprietary SureScan MRI technology, and so that allows patients to get a full body MRI, and it's the only sacral neuromodulation system with this sure scan technology. And so what this means, and some of this is a little bit nuanced based upon having the therapy or not, but what it means is that there's no impedance checks that are required prior to getting an MRI. So there's not any special ways that you need to further test the device before getting the MRI. And you're actually even allowed to get an MRI if some of the number and feedback that you get from your device is what we call out of range. And it's you can actually easily activate MRI mode from your smart programmer that you have, the little smartphone appearing device. And then there's a digital display that is on there that lets you know clearly that it's in the MRI compatible mode, so you can feel safe and secured with getting any testing that you need. Okay, so is this therapy right for you? Um, well, First, talk to your providers, okay? Make sure that you are discussing with your physicians what symptoms you're experiencing so the evaluation can happen to understand what is the core cause of your incontinence so that you can understand if you might be a candidate for InterStim. So, what makes someone a good candidate? If you have significant symptoms like urge incontinence and urgency, frequency, bowel leaks, um, or sometimes you have like the non-obstructive variety. And again, your physicians and your team can kind of help walk you through the process of categorizing what exactly your fecal incontinence is. If you've tried other modalities, if you tried the lifestyle changes, if you've done the pelvic floor rehab, if you've done the biofeedback and all of those things, you might be a candidate. And most important, if you're not getting the relief that you want, if you are not in a position where you have at least a functional level of quality of life, that is more than enough reason for you to go explore whether or not you're a candidate for sacral neuromodulation. So, if it sounds like your experience or the questions that you might be asking yourself this evening, then reach out to your provider, reach out to me so we can start your evaluation to see if you're a good candidate. This is a proven therapy. 89% of patients that are using the Medtronic bowel control therapy experience long-term success. This procedure and device has been available for decades, so it is trusted and true. Um, you can experience a significant improvement in quality of life. So your lifestyle, ability to cope, ability to have fun, ability to travel, ability to interact, ability to be intimate should you need to be. Um, it offers proven results. There's very important data that it is safe and effective. Um, it's been around for bowel control therapy alone since 2011, and it was available for bladder control well before that. And so S&M is the only therapy that actually has been proven to provide better relief than medication. And there's been over 425,000 patients who've received this therapy over the past 25 years. So here's Alan. He's an InterStim ambassador, and one of the main reasons we have Alan on the page on the screen is because he may not be that typical patient that you may assume may have fecal incontinence or bowel incontinence. And so again, it's a prevalent issue. It's more common than Alzheimer's, than asthma, so we need to talk about it. And so here Alan shares with us, I can do so many things that I want with less worries. This is so empowering. Okay, I've beat you down with all the details. So what happens next? We're going to open the floor to questions. So please feel free to use the Q&A or chat function that you have, and we'll be more than happy to answer some of those questions. My contact information for my office is here on the screen if you want to reach out for a consultation. And then if you answered the poll, there will be some additional follow-up opportunities. So again, if you are in a position where you want to be able to ask questions a little bit more discreetly and anonymously, someone can kind of reach out to you to kind of walk you through those things as well. So again, thank you so much for your time this evening, and we'll open up the floor to questions.